right. Here we are again, another Thursday, another Zooming with Dan. Last week I had the absolute honour of chatting to David Steele, who was an amazing and inspirational guest. It was great just being able to sit back and listen to David tell his story. I'm very thankful he was able to be so raw and candid in detailing his journey with MND. Although David is living with this horrible disease, he manages to keep his sense of humour and stays as positive as possible throughout these difficult times. David already does, and he will inspire many more people into the future with his exceptional attitude to life. Tonight, I'm thrilled to be joined by three professionals and all-round great people from the Barwon Health MND Clinic down in Geelong. We heard all about David's story last week, and it's this team in particular at the MND Clinic who will be helping him throughout his journey. Jeanette, Ingrid and Jen have gone into the office tonight to join me, and I'm very thankful for that. MND is a very unique disease that affects around 440 Victorians at any one time. The Barwon Health MND Clinic is one of a few specialty one-stop shops around Victoria where those with the disease can access all the relevant allied health professionals that are needed throughout the MND journey. All these professionals make up a huge multidisciplinary team that are expertly trained in this disease and are able to provide the best and most up-to-date services and care. MND Victoria have a great relationship with the whole team at Barwon Health and work very closely and collaboratively to ensure people with MND from the western side of Melbourne right down to the southwest coast of Victoria can receive the best possible care and support so they can live as well as possible for as long as possible. Tonight, one thing I would like to do is really encourage questions throughout this conversation. Being able to have three professionals in the MND space with me tonight is a great thrill, and I certainly hope the audience will benefit. I might hand over to Jeanette now, who is the MND coordinator at the clinic, to talk more about the clinic itself and what her and her team is there to do. Jeanette.
Thanks, Dan. I think I'd like to start by thanking you for inviting us. We're thrilled that we get a chance to showcase our MND clinic that we're really proud of. So probably just to start with the history. So back in 2012, Calvary Healthcare Bethlehem, who we know are the statewide providers of progressive neurological conditions, did a really comprehensive survey. One of the biggest things that came out of that survey was that people wanted a service closer to home. So when Calvary looked at the numbers in the regions, Barwon had a reasonable number in that Barwon southwestern region. So Calvary came to Barwon Health with the initiative to start up a clinic. Barwon Health ran with that initiative, and we are the first pilot service with Bundoora now also having a MND clinic. So we have a really highly skilled multidisciplinary team, as you alluded to, Dan. And yeah, we are like a one-stop shop, and you'll hear more from two of my colleagues tonight, more specifically about what they do. But we do provide specific interventions to people with MND, as well as support, advice and referral out. So as well as our highly skilled allied health team, we have a team of medical staff. So we have a shared governance in this clinic, with our clinical governance coming from Associate Professor Paul Tallman, who has been working with people with MND since 1991. So there's lots of skill and knowledge there that is shared with the team over the time. And obviously the team have really skilled up since we started this clinic back in around that 2012, 2013 time period. We also, as well as having the medical and allied health team, we have a service agreement with Austin Health and their Victorian Respiratory Support Service, so VRSS, who attend our clinic on a regular basis to provide specific respiratory support, advice and intervention. Important to acknowledge that we also have really strong working relationships with palliative care teams, and we have an amazing palliative care team within Barwon Health, and obviously with MND Victoria, and with teams like our advanced care planning team, which are another incredible Barwon Health team that we rely on. So I think, like you alluded to, Dan, we cover a pretty big geographical region, and at the moment we have people come from Portland, Ballarat, Bendigo, Hamilton, Horsham, and all those western regions of Melbourne, so Point Cook, Werribee, and Melton. It's probably another important part of our role, particularly given that large geographical region that we cover, is to provide secondary consultation to some of the more local providers. We obviously can't always get to our patients, particularly those that might live a distance away. So it's really important that we can provide that secondary consultation and use our expert MND knowledge to educate local teams and help them support the clients more locally. So to attend our clinic, you do need a medical referral, and that's really because we are a Medicare bulk billing service. Probably to describe our team, we work from what we call a neuropalliative kind of approach, meaning that we work with people from diagnosis throughout their illness, all the way through to the end of their life. And I think that's probably, Dan, one of the things that I particularly love about this job, is that the patients do have a consistent team that they can rely on throughout their journey. And I think really for us, that chance to get to know people through the journey, it's a real privilege to work with them at such a critical time. And really, I think, you know, despite being diagnosed with such a devastating disease, to see the courage and the resilience of some of these patients really kind of makes this job very valuable for us as well. There is lots and lots of evidence now that a multidisciplinary team contributes to symptom relief and particularly to quality of life for people with MND. So we're fortunate in this team to feel like we can make a real difference to our patients. Yeah.
Wow, what a wrap up! I've literally learned something in that few minutes. So thank you. Yeah, really detailed. Let's talk a little bit about you. You're clearly very, very well respected in the MND space and your team there, and from our organisation at MND Victoria. So what does your role entail, and what's your background?
So when I first started in the team, I started in the social work role and moved into the coordinator role around three and a half years ago. So there's a few key parts to my role, and one of the biggest parts of my role is to provide leadership and management to the awesome allied health team. I think that this role can impact us, particularly, as I say, when we're working with people through to the end of their life and we have gotten to know them. So we have become a really tight, cohesive team. And I think that there's lots of reasons for that. We share an office space, so there's really good communication that goes on every day. But I think because we do need to and do support one another really well, I think different areas of the work impact people for varying reasons, really. Sometimes, you know, there might be a patient who may have kids that are a similar age to ours, for example, and that may trigger something for that particular person. So we sometimes have our days, and we do very much rely on each other and work really closely with MND advisors around that too, to share that to workload and look out for one another. My other big part of my role is that I am the initial point of contact for the team and take those initial phone calls. We do really encourage our patients to ring when they need to. So we may, for example, book someone in for a review appointment in clinic in 3 months' time, but we're always saying to patients, please ring prior to that if something's happened. I think with MND, we just don't know what course it's going to take, really, do we? There is no set pattern. There's varying phenotypes to this disease, and there's no step-by-step as to what's going to happen for every person next. So if, for example, someone starts having some swallowing changes or changes to their mobility, or the carers require some emotional support, we always say don't wait for your next review in 3 months when we're then trying to fix things that we may have been able to work towards earlier. Ring us, ring in or troubleshoot over the phone, come out and visit, or we'll move your appointment sooner. So I think that that's really important that we can do that. We might have someone, for example, ring in that may have started coughing on when they're eating and drinking, or, as I say, might have changes to their mobility. So we could be out there. We need to be responsive, I think, is what I'm trying to say, rather than waiting for them to come in for their review appointment. So part of my role then is to do that initial phone screen when clients are first referred to us, and to identify risks, and then to schedule them into clinic for an appointment. So I coordinate all of those appointments. At the moment, most of our appointments are via telehealth, which is great for us. I think we were using telehealth before the COVID-19 climate, again, particularly for those that live outside of this Barwon region. So another big part of my role is to coordinate our care plan. And I think a care plan is another very key part of our service. When people, particularly when they come in the first time to clinic, and they might see the neurologist and then move around and see one team member after the other, it can be really overwhelming, and it can be really confronting to see clinician after clinician, to be asked a series of questions over what could be a couple of hours. So we do develop a written care plan, which provides a summary of everything that we've talked about and provides a list of recommendations that clients can then take with them to their GP, to their local service providers, share with their family. So I think to have that written information, that they don't have to maintain all the information that they've been given in that one clinic visit, is great. So again, then part of my role is just to ensure that there is monitoring and follow-up for all of our patients. And then, because all of our clients come through to the one number, yeah, it's not uncommon to be doing lots of practical and emotional support for our clients over the phone. So then there's also the part of my role that is responsible for quality assurance, and we have got a couple of good research projects going on at the moment. Yes, I think that's probably it in a nutshell.
That is a substantial role, and yeah, thank you for sharing. And I think one thing I pick out of that, and I know we're going to touch on a bit more about the overall care of someone with MND later, but just the fact that you are always there, you and the team. You know, someone with MND doesn't have to wait weeks or months to come in and see you all. You are there via phone, and you know, during this time in particular, COVID-19, it's such a critical service. So yeah, that was great to hear, and we'll talk a bit more about that later. Huge role for you, but you have a great team around you. So why don't you give a little introduction to Ingrid and Jen? What do they do? And then we'll hear a bit more from Ingrid after you.
Yeah, great.
Both.
So I have got Ingrid sitting beside me, who is our dietitian in our team. And I think until I worked in this team and until I met Ingrid, I had absolutely no idea about the scope of practice that dietitians contribute to, really. I think I thought dietetics was all about diet, but I've learned a lot from Ingrid around PEG tubes and around topics like how diet can impact on wound care recovery. So I think there's, I credit to dietitians that their role is far more varied than I thought. And then I've got Jen, who took over the social work role when I moved into the coordinator role. I always knew how awesome social workers were. So And Jen's a great social worker who well and truly trumps me in that domain. So pleased to introduce them. And probably what I want to say before we move on to Ingrid, Dan, is I just want to highlight with our allied health team that for us, there's a really fine line between respecting where patients are at and how much capacity they've got to take on information and our recommendations. We're often working ahead of time. We want aids, equipment, we want advanced care plans in place. Sometimes we know the benefits of having a palliative care team involved. Our clients are not often at that point. They're still digesting the diagnosis. They're still kind of wrapping their heads around what that means for them. So I think probably for me, before I hand over to my team, I just want to highlight, and it's a shame I haven't got my whole team around me. I've got a lot of really skilled clinicians who are all really good at their communication, but respecting where our patients are at versus trying to prepare them for the future as much as possible. I think there's a huge skill in that. So I just want to highlight that for my team.
I think we can have more from your team down the track. I think you've got plenty to offer. So, but before we do that, Ingrid. Thanks, Jeanette.
Jeanette. Hi, Dan.
Hello. So, world of being a dietitian in the MND space. Talk me through that. I know you could talk for probably hours, but why do you do what you do? And I guess what are for you the most important parts of a dietitian in someone with MND's life?
So a perfect example of that would be that lovely Zooming last week with David when I was watching. I've only seen David once initially, and it was fantastic that he could remember something that I had actually said to him, and that was that he could eat what he wanted to eat. And I was really thrilled that he could actually remember that bit of information. So it's those little things to me that really count. But yes, my role is very varied. So when it comes to the client, initially when Jeanette sort of sees them and she asks them a few questions, about their weight and how they're eating, people sort of scratch their head and go, well, I'm eating okay, and, maybe I've lost a little bit of weight, why do I have to see the dietitian? So my role is to talk to them and explain to them how nutrition can actually impact on your quality of life and your longevity with the MND. And so that might be around, malnutrition. For some people, it might be around that really delicate topic about, tube feeding and if that's right for that person, and, talk about those windows of opportunity and just really trying to help that client and their family through that journey, from beginning to end and what that might look like. And, there's no right or wrong answer, when it comes to, say, tube feeding. It might be suitable for someone and it might not be suitable for others. There's no right or wrong answer for that as well. Yeah. What I also do is, so that's quite sort of client focused, but then I'm also involved with working with some of those other regional allied health dietitians, even GPs who may have never had a person with MND before. So I guess, I'm often upskilling them and helping them get through their side of things as well.
Yeah. Talk to me a little bit about, you touched on David last week and the advice that you give him to just keep eating, eat what you like. And because that resonates with me because of, my dad and the amount of custard and ice cream and cake and that it is loved eating, and there's not much good comes out of MND, but being able to eat what you want, it's not the worst thing. Yeah. Talk through why that's important and why keeping the weight on is such a crucial part.
So the research shows that usually at diagnosis, around 55% of people will actually be malnourished. So that's, quite significant. And what happens is some consequences of that. So people's immune systems can become compromised, so then they're more susceptible to like colds and flus, gastros, viruses, even this new COVID. So it's really important to try and keep their immune system, as strong as possible. There's the other thing that Jeanette touched on, that, if you've lost a lot of weight, if you're malnourished, then you've got a higher risk of developing pressure injuries or pressure sores. And we see, with our clients, some people who can't walk around and need to be in a wheelchair or in a bed or in a recliner, they can be at greater risk of those things as well. I guess another thing is, which people don't often think about, is malnutrition can be related to your cognitive issues as well. So sometimes people, if they're malnourished, they can become depressed, they can be apathetic, they may not engage properly with their family members as well. And another really interesting one is feeling cold. So when people are quite malnourished, they often feel cold, and sometimes people report that to me, I'm feeling quite cold. So, and I guess the really other biggest thing is it is an independent risk factor for shorter survival, being malnourished. So my role is to try and help them and support them as best we can, whether that might be through eating what they love, or eating, as you say, custard and ice cream and cakes and things like that. That's important. And the other side of things is I'm quite renowned for, they call me the Bowel Queen, because I'm always talking about bowels and constipation. Diet plays quite a big role in that.
Can we change your name on Zoom to the Bowel Queen? I think that might be
it's a bit of a standard joke around here and with my clients, oh, here she goes, she's banging on about the bowels again. So, but, I guess, your diet plays a really important part, how much fluid you're having, how much fibre you're having, are you on any medications that could be contributing to that constipation? Are you not drinking because you can't access the toilet? Are you not eating because, you can't use your hands to feed yourself and there's no one there to help you? There's so many different variables that can be contributing. And it's not like a one size fits all. Everyone's sort of individualised with their own particular circumstances.
Yeah, absolutely. Like most of the professionals that I know, every day will be different for you. So, take each day as they come. And I think obviously I'm not in your field, but it would be fascinating to see all the different challenges that you're faced with and how you resolve them. So I might, we'll touch on a bit more later, but I might, in the interest of time, we might get Jen up to the screen, and let's hear a little bit about her role in the social work field. And I think I'm interested to hear the work you do with people with the disease, obviously, but also the work you do with their families, in particular, immediate families. It's a topic I don't think gets touched on enough. MND is horrible to the person with the disease, but it's equally as bad to the immediate family. So I'll over to you.
Yeah. Hi, Dan. I guess the best way that I can really describe my role is I sort of divide it into two sections. There's the practical component where I work with families and patients around accessing supports if they're over 65 through the aged care system, which often involves quite a lot of advocacy. If they're under 65 through National Disability Insurance. But there are a whole other, raft of other things that we do as well within our social work role. Sometimes, and it varies, it can be different on any day. There can be housing issues, there can be financial issues, there can be issues within relationships, and often legal issues. Get involved in things like assisting people with powers of attorney. Sometimes we even have to go to VCAT when somebody has lost cognitive capacity and they need, families or carers need assistance with accessing finances, or having to make really difficult decisions for people, sometimes around accommodation and having to enter into a care facility. And then there's the emotional component, I guess, of the role, where we provide emotional support counselling for patients. And a lot of the time, I find my role tends to be that support is needed for the carers and the family members. So we were very fortunate here recently to be able to trial a carer support group. Started running a support group once a month together with one of my colleagues here in the social work space, where we provide support for families and carers, and that's been really great. We've had some really positive feedback about that. Unfortunately, all on hold because of COVID at the moment. But the reason that we started that was because we would often hear from carers that coming into clinic was very much about the patient and trying to do all the different assessments that we need to do for OT, physio, speech, dietetics, seeing the doctor as well, and that the carers themselves weren't necessarily having a space where they could talk about how they were feeling. I think for carers, so often they spend so much of their time caring and not wanting to perhaps express their grief and their sadness and what they're struggling with in front of the patient, that we wanted to give this opportunity for them to have a private space where they could explore what they're feeling and express what they're feeling with other people who are going through the same journey, different stages of the journey sometimes. And so that's been really successful and something that we hope to continue once COVID is over, hopefully soon.
Hopefully soon.
Yeah. So we definitely encourage all of our family members or our carers to link in with our social work service, or otherwise we refer out, because we are working with so many patients in different regional areas. A lot of the time it is referring out to other services. Some of the palliative care services do have counselling, bereavement follow-up, but some of them are smaller and don't have that, and so we might look at other ways as to how people can access that support.
Beautiful. Such a huge role in the MND journey. So
it's an honour. So we really enjoy doing what we do. We really feel honoured to be able to help people in this really difficult space they find themselves in.
I love that. And hearing so many professionals with that sentiment is a really nice thing for me to hear, and for everyone else in the space to hear, because yes, it's more than the job, which is great.
Yeah.
I thought we might move into a little bit of a discussion. We're doing our best to socially distance with you all in the office, but we can all hear you. I've got a few questions that have come in, so I'll put them out, and a few points to put them out at the relevant time. But the first thing I want to ask, and whether Jeanette, you want to answer, or Ingrid or Jen, you can chime in with an example. MND Victoria, how does MND Victoria fit in with the work you do and the work that you do with our advisors and vice versa? Jeanette, you want to talk us through that?
So we've already talked about what a cohesive team we are and how reliant on one another we are. And I think we have to consider the MND Vic advisors as part of our family here. I don't think there's a day that goes by that we don't speak, probably particularly to Trish, who covers the Barwon region. Have a lot of respect for Trish. Equally, Ruth, Eric and Lauren, we have a lot to do with. I think because we're a part-time service and we really do need to be as responsive as we can to this deteriorating, sometimes rapidly deteriorating disease, that it's amazing to have the regional advisors on the days that we're not here, or just to help us to provide a service as quickly as we can. There is a little bit of an overlap from time to time, which is really useful though too, because sometimes Trish might say, I've got capacity to do that referral right now, when I don't, for example. So we can kind of share responsibilities that way. But where we really rely on the advisors as well is in and around their NDIS role. So the NDIS is a changing landscape. Thank you, Ingrid, absolutely. And the regional advisors seem to be really on top of that. The regional advisors also have amazing contacts locally. So for us, we're dealing with so many different service providers, so many varying palliative care teams, that if we do ring the regional advisors who know those areas really well, then they can point us in the right direction, put us in touch with the right people. So similarly with the equipment library, we're so fortunate in the MND space, and other people have talked about this in previous weeks, obviously, Dan, that if we couldn't access that equipment library, we can't afford to be waiting weeks and months for aids and equipment for our patients when they are deteriorating at the rate they are. So only good things to say about MND, Vic. Couldn't do the job without them.
Yeah. And I definitely find, Dan, that in my role within social work, there's a lot of overlap with what I do and what the advisors do. And we work really respectfully with each other. We keep in contact. They email me, I email them. There's always a line of communication going between us in terms of what they're doing and what I'm doing, with regards to that sort of support base and referring on to aged care, my aged care for packages, or what they're doing with NDIS. So we work really closely together.
Isn't it?
Yeah, and it works really well.
And also, Dan, like in this non-COVID environment too, Trish or Lauren would come to our team meetings as well. So it's not just about phone or email, but there's also that face-to-face contact with them as well.
And it's great to hear. Like, obviously, our mission at MND Victoria to provide the best possible care and support to people living with MND. We can't do that without you. So it's great that we work so closely with Barwon Health and Calvary, Beck, and the many other providers. So it's a great, well-oiled machine all around Victoria. One more. Well, I've got a couple more questions. We're going to go over time, but that's totally fine. You mentioned earlier, Jeanette, that it is a part-time clinic. Talk me through that a little bit, and also, and more importantly, what's the wait time to come into the clinic for review?
So most of the team work 2 to 3 days a week, and I work 4 days a week, which is also where I think the MND advisor roles are really key, that they can pick up issues when the team may not be here. But despite being such a part-time team, we really try not to have a waiting list. I can't afford to have a waiting list with this kind of clientele, really.
Yep.
So referrals come in, we try and get onto phoning them as fast as we can, really, and trying to book them into an initial clinic appointment as quickly as we can. I guess the tricky part for us is that clinic appointments do fill up fairly quickly. So sometimes there might be a couple of months before that initial really medical appointment. The allied health team work more than our medical team do. So if we can't get a medical appointment as fast as we would like, we'll book them in with the allied health team first, just to really try and get those connections happening, just so the patients know that we're here, they can meet us. We don't want them waiting at all if we can help it.
Love it. Ingrid, I'm going to throw one back at you, and it's something that you brought up and then I brought up again. The term eating what you want. We've just had a little comment on Facebook around, potentially dangerous term, because eating what you want can potentially lead to other conditions such as diabetes and then more drugs. So if you want to just talk me through that, there's obviously common sense and other medical practice that goes into it, but if you can talk me through the way you'll handle that sort of statement.
So that example that you gave me about diabetes, really that's fairly insignificant compared to MND. And, if someone developed diabetes from eating what they wanted, which is probably highly unlikely given that MND clients usually have an increased calorie requirement. It's not something that I have come across, and it's really insignificant in the bigger picture.
Thank you. I just want to go into quickly the huge multidisciplinary team that we have talked upon. I know we had Sarah Solomon OT from Calvary a few weeks ago, and there's many more staff members and team at at Barwon Health MND Clinic. Talk me through how you all work together. And a lot of people that aren't impacted by MND or that haven't had a loved one impacted by MND won't understand how big the team is and how many professionals are needed to come into their life. So if someone wants to jump in and talk us through what a team looks like and how you all do work together.
Yeah, so I think I've said a few times today, I used the word cohesive a few times today, but I think that also comes because we do have lots of overlap in our team in terms of our physio and OT, for example.
Yeah.
Often do joint assessments, sometimes do joint home visits in terms of setting up equipment, in terms of something like hoist training, for example. Our speech therapist and dietitian might have overlaps when we're talking about diet and nutrition and secretion management. Thank you, Ingrid. And then sometimes our OT might go out to the home and, let's say, for example, she might be measuring up the shower for rails, and Jen might be in the kitchen with the carer, providing carer support. So there is lots of that joint assessments that happen. I think sometimes, and I'll let Jen talk about this a bit more, it can also pose challenges for us that there are a lot of people that come into these people's lives, as you were saying, Dan. So there's not just our team and the MND big advisors, but then there's a NDIS planners and NDIS personal care workers, and there's palliative care staff, and then they might come and meet someone to do their advanced care plan, and then their GP and the urologist, and the list can go on and on and on for people, really. So that's one of our challenges, and I think that's again why I emphasised our care plan earlier, because if that's a way that we can communicate as a broader team, not just beyond us and the patient, so that we're all working towards the same goal, really. But yeah, we spend a lot of time communicating with a lot of different teams, and that can be have its challenges at times, versus a bigger team making sure that the clients are also not left isolated. So fine line sometimes, I think.
Yeah, and, we've used the term one-stop shop a few times tonight, and whether that undersells it, I'm not quite sure, but it is such a good term that describes what you all do. You are all professionals in that M&D space that you just can't get anywhere else. So to have that resource available for so many people is critical. I'm just going to ask one more question. I know, Jeanette, you touched on it earlier about the COVID-19 situation and the majority of your appointments coming via video link. Can people still come in and see you?
I think at the moment we are starting to talk about patients coming in to see us. It's still a bit of a tricky space, to be honest, Dan. I think we would like to meet some of our newer referrals face-to-face.
Yep.
Perhaps a bit reluctant for some of those that might be a bit further down the track in their journey, particularly those that have got some respiratory issues. We share a centre here with a number of other programs, so I guess we're being a little bit conscious of the fact that there are other people in the waiting room starting to come here. So probably the best answers to that is yes, we're starting to look towards that. It'll be very much a case-to-case basis at the moment.
Very good. Well, I think we could probably talk for hours, and we've got a lot of knowledge on one screen, but I think it would be great down the track to have some more of the team from Barwon Health back, because it is the experts that people want to hear from. So I thank you for all your time tonight, and the fact that you're not in your lounge room like we all have been in the past. You've all headed back into work. So I appreciate your time, and I hope the audience has certainly got something out of all your presentations and your brief descriptions of what you do, because that's what it is. There's so much to your daily work life in the M&D space, and I think, as I said, if we could talk for hours, we would, but I think that'll wrap up tonight. yeah, that's really it for me. So good night.
Yeah,
And,
thank you very much, Dan.
Thank you.
catch up soon.
Have a great week. Cheers.